7th anniversary of the passage of the Affordable Care Act. And yet today, House Republicans in the United States House of Representatives are scheduled to vote on a bill to repeal the Affordable Care Act and replace it with a new law which will be disastrous for Hoosiers. In fact, that potential devastation to health care will threaten almost 1/2 million Hoosiers if this Republican health care plan is passed today. Unfortunately, it looks like at least almost all of the Republican members of the congressional delegation stand ready to pass this bill. But before they do, I would ask that they consider the following. As I mentioned, the Republican health care plan would result in over 470,000 Hoosiers losing health insurance coverage. By the way, these are estimates that are being handed out by the Nonpartisan Congressional Budget Office, the CBO. HIP 2 alone, which we took great pains to enact and do it in a way which then Governor Pence thought was the right way to do it. HIP 2 alone covers 400,000 Hoosiers. But that coverage is also put at risk due to a provision that we put in that bill, which triggers the repeal of HIP 2 if the Affordable Care Act funding is reduced. And that's exactly what they're planning on doing out in Washington, D.C. What's the bottom line on this? Well, without that enhanced federal matching dollars for HIP 2, Indiana would have to come up with an extra $500 million a year to maintain funding for the current program. Now, this loss of funding is coupled with another crucial loss when we look at the addiction issue that we have here in the state of Indiana. In the midst of the opioid crisis facing Indiana, the Republican health care plan would remove mental health and substance abuse treatment from the list of essential benefits, putting Hoosiers at risk of losing those services. So all the hard work that we're doing this year to try to address the issue of opioid addiction, to provide people with the mental health services that are going to have to be necessary to treat that illness, that's going to be removed as an essential service underneath the Republican health care plan. Fact of the matter is that people are going to lose their coverage because the Republican health care plan will cause premiums to rise dramatically, especially for lower income and middle class Hoosiers. And as Senator Groh is pointing out here, the CBO estimates that for a 64-year-old individual making $26,500, the premiums would rise. Currently, they are approximately $1,700 a year for that individual. They would rise to $14,600 per year. That's over 7 times what they currently have to pay. No wonder people are going to lose their coverage. So, this is the devastation that I've been mentioning here in my comments this morning. And the irony of ironies, when you look at this bill, guess who is the group who benefits from this bill? Well, the federal budget savings that would occur due to the loss of federal funding for these programs. Well, don't you know that there is a proposal for a $600 billion tax cut exclusively for insurance companies and the top 1% of earners? So this is the looming catastrophe which faces the state of Indiana. I raise all this because here we are in a budget, and I'll ask my fellow senators if they want to comment on this at any point in time as well. But here we are in a budget year, and up to this point in time, we have heard no proposals or solutions from the Republican supermajority on how to address this looming catastrophe created by the Republicans in Washington, D.C. Now, you might ask, well, what can be done? Well, that's an excellent question. There is so much uncertainty over what's happening now in Washington, D.C. It's really causing quite a unknown factor to exist here. But we do know these figures from the CBO are accurate. We know that there is a potential health care disaster looming in the state of Indiana. At a minimum, we ought to take a look at that trigger that was put into the original HIP 2.0 plan. see if we should be repealing that trigger so we don't have to look at an automatic repeal of HIP 2.0. The governor should also be calling upon us to conduct field hearings, to perhaps have the health finance committees to be meeting on an interim basis to figure out what can be done to mitigate all of these problems. You know, since the Affordable Care Act was enacted 7 years ago, and since we finally enacted HIP 2.0, the uninsured rate in the state of Indiana has dropped from 13% to 9%. Now that's real progress. That's real progress. As I said previously, HIP 2.0 alone covers 400,000 Hoosiers. And we worked hard to do this, what we said was the Indiana way. We shouldn't allow politics out in Washington, D.C. to undo all the progress that we have made. It's no wonder that organizations such as the AARP, the American Medical Association, and the Indiana Hospital Association have all come out opposing the Republican health care plan in Washington, D.C. And what we need to do here now in the state of Indiana, we need to get prepared. We need to get prepared to see what we can do to try to mitigate the damage which is going to be done in Washington, D.C.